Good evening, listeners, and a warm welcome to Views on Health. Back with us on the program this week is Dr. Sithira Seneviratne, consultant geriatrician at the National Hospital of Sri Lanka. Welcome back to SLBC, Doctor.
Thank you.
Pleasure to have you with us once again. And having discussed geriatrics on the program last week, tonight it's age-related health issues. Without any further ado, over to you, Doctor, to tell us about all these issues that the elderly are facing.
Thank you very much. So last week we discussed that when you get old, there are a lot of non-communicable diseases, and there are age-related unique health problems, and there are a lot of psychological problems. And when you think about age-related unique problems, falls are quite common. And we discussed few things about falls last week. And in hand with falls, we have to discuss about osteoporosis. So osteoporosis is your bone getting weaker as you grow old. So we see this mainly in females more than males. Both males and females do get osteoporosis, but more in females because of the hormonal changes. And osteoporosis is something which can go unnoticed because it can be asymptomatic. And some people often get back pain with the fractures, and you might see people developing hunchback, and they are becoming sometimes losing their height. So these could be early signs of osteoporosis. So if you have tendency to fall, or if you're having any of these symptoms, or if you are just more than 60 years old, better to get your osteoporosis screened. There are several ways of screening for osteoporosis. There are instruments like FracScore made to calculate your risk of having a fracture, and also there are scans like DEXA scan to scan your bones and to see whether your bone mineral density is low. And if you have osteoporosis, one good thing is there are treatment options. So these include calcium, vitamin D supplements to strengthen your bones, and there are a lot of other drug classes which will able to strengthen your bones. And moving from osteoporosis, there are some other age-related problems. One of the hidden problems is urinary incontinence. This is not much spoken as a disease, but it has been shown in some studies, if you are more than 65 years, 50% of the population could get urinary incontinence at some point. And like falls we discussed last week, urinary incontinence can also be multifactorial. It could not be sometimes due to a single reason. It can be due to a single reason in some instances, but most of the time in old age, you get urinary incontinence as a result of multiple risk factors. So again, what you need to do is you need to get a comprehensive geriatric assessment done and find all the contributory causes for urinary incontinence and correct these risk factors to get your symptoms sorted. So we have seen that urinary incontinence has been associated with a lot of other medical problems, like it can give rise to more urinary tract infections, it can give rise to hygienic problems, and it can also associated with falls again. And this can also lead to social problems, like people with urinary incontinence, they don't like to go out of the house, they are not comfortable. This can lead to a person being homebound. That can also affect their mental well-being. And there are several types of urinary incontinence. So some people have involuntary leakage of urine when you cough, when you sneeze, when you laugh. And some people have involuntary leakage of urine when they have the urge to urinate, but they can't hold bladder until they go to toilet. And there are some other types of urinary incontinence, and these symptoms can be mixed as well. So if you have these symptoms, so you have to get you screened by a physician, and then once your assessment is being done, depending on the problems, you will be offered treatments.
Thank you, Doctor. It's interesting to know that all these medical issues can be addressed. But one needs is to go in for timely consultation. Having said that, just focusing on what you said last week about healthy aging. So we can go back to that, where when one is about to reach 60, a few years ahead, or I don't know, you have to tell us how many years ahead, we need to pay particular attention. I mean, we have to take care of our health all along, but particular attention to certain aspects of our body, because we are going to that different level age-wise, and we cannot do what we did before. So would you advise our people, generally our listeners, to slow down? When I say slow down, I mean you have said to be active, mentally active, physically active, yes. But still, mentally active is no issue. You can read, you can do puzzles, you can play some games that keeps your mind ticking. But physically, yes, walk and do whatever you can, housework, your own thing. But would you say that it's advisable not to do certain things to the level that you did before?
This can be a quite tricky question to answer, because the main problem most of the time we see in old age is not being engaged enough physically and cognitively. So, but as you said, there could be certain limitations. So, especially if you have high risk of falls and fractures, so we need to avoid doing risky things. Like if you have difficulty in walking, better not to try a ladder. So you have to be aware about your falls risk. That's quite important. But same time, you have to make sure that you are not immobilized, you are not homebound. You have to engage in physical activity as much as possible. And physical activity is one thing that has been shown to reduce problems in old age like frailty, and which will improve with your muscle function, joint function, and balance. So you have to be aware, as I said, about your falls risk, but be active.
Doctor, you spoke of urinary problems, and if a person has such problems under medication, under medical care, can it be stemmed so that the person will not have an accident? I mean, you want to pass water, you can wait till you go to the toilet, as against just it happening where you are. Can such an accident be avoided through treatment?
Yes, of course. So
can the bladder be strengthened?
Yes, of course.
Your control can be strengthened.
Yeah. So there are non-pharmacological methods. That means treatment methods which doesn't include drugs, as well as pharmacological methods where we offer drugs to strengthen your urinary control. So one of the most important thing is pelvic floor exercises, which is also a part of healthy aging. So if you practice pelvic floor exercises, we also call these Kegel exercises, and that has been shown quite useful to improve your bladder control. And also there are some other methods called mind over bladder method, which these things will be discussed in a specialized incontinence clinic. And also there are certain medications that we can offer to relax your bladder and to improve your urinary control. So there are a lot of treatment options available.
What about vision?
So vision is quite a important aspect to screen when you grow old. It's a part of comprehensive geriatric assessment. So if there are any vision problems, we better to consult ophthalmologist and get that sorted. Special problems like cataract, age-related macular degeneration, and if you have diabetes, you have to get your eye screened quite regularly to see whether you have any complications of diabetes. And there are other problems like glaucoma, which can be associated with these problems can be associated with aging, and it's a part of comprehensive geriatric assessment. And then you will be referred to ophthalmologist as required.
Doctor, polypharmacy is a term that we have come across. Could we explain what that is?
Yes. So polypharmacy is using 5 or more medications concurrently. So this can be over-the-counter prescriptions, and this can be your prescriptions given for your diseases. So if you are taking 5 or more medications, it has been shown it is an independent risk factor for falls. And these medications, they can have medication interactions, they can have medication interactions with your other systems. So what we do is recognize polypharmacy as a disease or a problem and screen your drug list and see whether the drugs have served their purpose over the time, and if the drugs have any side effects in your body, and then we have to sometimes balance between benefits and risks, and then cut down your medications. We call this de-prescription. So, and there are some drugs which you might find useful when you are younger, but when you are older, these medications can be harmful. The quite common example is blood pressure medications. So when you're younger, we try to maintain a lower blood pressure, so we might give you multiple blood pressure medications. But when you grow older, you become frailer, and you might not be able to tolerate multiple blood pressure medications. Most of the common symptom is when you get up from lying down position or sitting position, some people feel giddy, and this could be a feature that your blood pressure is dropping when you are standing, when you're changing your posture, which is a risk factor for falls. So you need to get your blood pressure screened, and then cut down your blood pressure medications and adjust your blood pressure targets. And also with diabetic medications, sometimes when you are younger, you might need strict blood sugar control, but when you are older, you might be eating less now, and your blood sugar medications might be too much for you, and we tend to have a less stringent blood sugar target when you are older, and might be able to cut down some of your blood sugar medications. And there are medications that can increase your risk of falls, like sleeping tablets, sedatives, can increase your risk of falling. So we have to find the falling medications and then de-prescribe those medications. So there are a lot of things can be done if you're on many medications. So we have to screen the medications and discuss whether they are appropriate now or whether they have any side effects, and then come into agreement and reduce the pill burden.
Doctor, I'd like to get some clarification on a point you made about 5 or more types of medication, meaning so that includes vitamins as well, supplements as well as any other sort of drugs that could be prescribed and is being taken. Say, for example, that you spoke of high blood pressure. Then you might take cholesterol or diabetes. So supposing a person has, say, 2 of those ailments, not 3, all 3, and then the doctor has prescribed, say, vitamin B, C, vitamin E, whatever, for vitamin D, for whatever reason that the patient needs. So then it goes beyond 5. So it's a mix of your prescribed drugs plus vitamins.
Exactly. So,
But if it's prescribed by a physician and then the person is taking it, how would it affect a person, the tendency to fall, the propensity to fall?
Yeah. So actually you have quite good point there. Sometimes when you have many diseases, polypharmacy is unavoidable sometimes. But you are taking 9 or more medications, we call it extreme polypharmacy. And if you are taking more medications, more the number of medications you are taking, more will be the interactions. What we need to understand is some of these medications, they are proven to cause reduction of complication over time, but we have sometimes not studied the combination of medications and their effects on certain outcomes. So we need to balance the risks and benefits of continuing medications, and to see whether really these medications have given you a benefit. That's a kind of a extensive process of coming into agreement whether some medications can be stopped. So it can be quite difficult sometimes, and it can be sometimes unavoidable. But important thing is to recognize it as a problem and trying to be prescribed and trying to get your medications down if you have to take more medications. So that will be useful in many other ways.
So, obviously, a physician who's dealing with the patient will be able to maybe say, you don't need to take this now, you can stop. Or would you say that sometimes you say you stop this for 3 months and then get back to it? I'm just only asking you, what would you say for something like, does that happen? Does that happen to where a patient is told, do that?
Yeah, sometimes we have to do trials as well. So just to see some. So there are some studies which has been shown if you are on 3 high blood pressure medications in old age, if you deprescribe 1 blood pressure medications, your blood pressure doesn't change much. So there are studies like that, and sometimes, as you said, the physician might try different things to get down your medications, and then if there are bad outcomes with deprescription, we might need to sometimes introduce the drug again. So it's a process of like getting your correct regime, your drug regime correct to prevent bad outcomes.
Thank you, Doctor. Very interesting. So, geriatrics, this very special branch of medicine, is very important in Sri Lanka, as we discussed on our program last week too, because of the aging population that the country is going to have in the very near future, I would say. Correct me if I'm wrong, but from what we have gathered,
you're quite correct.
We are going to have a large aging population.
So if you look at the demographics, we are reaching 21% of our total population being more than 60 years by 2025. And by 2040, we are going to have 1/4 of our total population, 25%, being more than 60 years of age. So it's a real problem at the moment.
And nothing can be done about it anyway.
Yes.
The aging population will obviously go on like that.
Yeah. So what we need to do is, one focus of geriatric medicine is to maintain quality of life and make the older people independent as much as possible till they are getting older.
So would you say that Sri Lanka can have in place various activities, maybe dedicated centers for the elderly, so that they will be able to attend those sessions, and then they can be focused on maintaining their health?
Yes. So at the moment, there are a lot of movements happening to address the needs of older people. And if you talk about the geriatric medical services that is provided, so we have a geriatric clinic at National Hospital of Sri Lanka, and we have some other geriatric clinics in Peradeniya Hospital, and the Teaching Hospital Kandy, and Teaching Hospital Ragama, and Kalubowila Teaching Hospital, as well as Wathupitiwala Teaching Hospital, Wathupitiwala Hospital. So there are a lot of geriatric clinics providing these services to people in Sri Lanka, and I'm sure there will be more services developing as time goes.
So that is important because in a hospital you have your dedicated medical team, and they were the best guides to tell an elderly person what to do, what not to do. Doctor, getting back to the problem of osteoporosis, what can a person do, healthy aging, going back to that, to protect your bones?
Good question. So having adequate calcium and vitamin D in your diet is very important. And doing resistant exercises. Physical exercises, as I said, has been shown to beneficial in many ways. They are good for your balance, your bones, and your muscles. So especially in regard to the exercises, there are several types of exercises, and resistant exercises has been shown to be beneficial in regard to your frailty and your protecting your bones. And so diet, exercises are the main things to prevent osteoporosis. And also if you are on high risk medications like steroids, so too much of steroids can cause osteoporosis. So as much as possible, don't take over the counter medications and get your medications screened by your doctor. And if you have high risk of osteoporosis, you have to get them screened and treated as soon as possible. So that would be the way.
Talking of health, going into healthy aging, would you say supplements at that age would help? Because or the diet alone should suffice?
So it depends on what you are taking and how much you can afford. And so if you think about the diet, so if you are having a nutritious diet, so it's not necessary to have supplements. But if you are not taking enough from your food, there's a place for having supplements.
Doctor, what about mental issues, for example, dementia, Alzheimer's, loss of memory?
Yeah, so it's quite an important topic to discuss when it comes to elderly care. So dementia is a term which we use for several diseases that affecting memory, thinking, and ability to perform your daily activities. So and it has become a major problem at the moment, and this causes a lot of dependency and disability worldwide, and it causes a lot of stress for the people who care for the patients. And this could be a progressive disease, and it can start with just memory impairment, and it can progress quite severely, where people might not able to recognize their loved ones. And you have to be aware about the early symptoms, and forgetting things of recent events, and losing or misplacing things, getting lost when you are walking or driving, and losing track of time, and trouble finding words, and difficulties performing familiar tasks could be early signs of memory impairment or dementia. In addition to the memory problems, you also will have sometimes mood and behavioral symptoms as early manifestations of dementia. For example, feeling anxious, feeling sad or angry, and personality changes, inappropriate behaviors, and withdrawal from work or social activities could be early signs of dementia as well. So if you have many problems, as I highlighted in the previous program, so you have to consult a physician or a psychiatrist and get your memory screened. And then there are several things which we can do to slow down the memory impairment.
Thank you, Doctor. So in end of the day, there are early signs that one can look out for. But is there a possibility of stemming the extent of the disease, the progress, or by anything that one can do through medication or exercise to stem the progress of dementia?
Yeah, so again, physical exercises and having a balanced diet has been shown to improve your mental health. So in regard to the progression of dementia, there are several medications and non-pharmacological methods that have been shown to reduce the progression of memory impairment. And so early detection is quite important, because once these things are progressed, so it might sometimes be difficult to treat those symptoms. So when you have memory impairment, the other important thing is the physician will look for any reversible causes. And there could be some diseases which are reversible, but there are diseases which are not reversible, where we only focus on symptom control and reduce the progression of the disease.
Dr. Time has caught up with us, and I'm reluctantly compelled to curtail this interesting discussion. So what is your take-home message?
So I think we have to be aware about the problems of old age, and it's important to get a comprehensive geriatric assessment done and identify problems early, and then get correct treatment to prevent worsening of your symptoms.
Thank you, Doctor. On that note of advice, we end this discussion on age-related health issues. To you, Dr. Sithira Seneviratne, consultant geriatrician at the National Hospital of Sri Lanka, we say thank you very much for being with us and sharing your expert knowledge with our listeners in the midst of your busy schedule. Thank you so much, Doctor.
Thank you very much.
Thank you too to Inoka Gamage for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday, same time on Views on Health.